Hi, I'm Dr. Lewis Clark. I want to thank you for taking time to watch this video concerning how to naturally control autoimmunity. Now, let me tell you a little bit about myself. First of all, I am a board-certified chiropractor in the state of Texas, and also I am board-certified in integrative medicine, which means taking physical, neurologic, and natural means and combining them together to get the best results with chronic and difficult conditions. So first of all, let's define what does it mean if you have an autoimmune condition. And we're talking about conditions or diseases like everything from fibromyalgia to hashimoto's, to celiac, to pernicious anemia, rheumatoid arthritis, diabetes. But not that only. Did you know other things like even things like irritable bowel syndrome, of course Crohn's and ulcerative colitis. Did you also know that even things like migraine headaches can be triggered by autoimmune conditions, or balance or vertigo problems because of autoimmunities to the cerebellum, which are very common. So a lot of times people don't know that their actual symptoms are caused from an autoimmunity, which means your immune system is attacking your own body. And let me say this, if you have any of those symptoms, or if you already know you have an autoimmunity, the next 5 minutes may be the most important 5 minutes that you're going to have concerning this condition, because I'm going to tell you up to this point you've probably been told there's nothing you can do about it. Just take these drugs to suppress your immune system and try to hold the symptoms back. And these steroids, as you know, are terrible for your overall health. But that's all you can do. Well, I'm here to tell you that is not the case. It doesn't mean that your autoimmunity can be cured. Unfortunately, once you have an autoimmune condition, the possibility of a flare-up is always there. Once you have made antibodies against your own tissue, there's always a possibility of a progression or a reemergence of that condition or symptom. However, what I am saying is that those symptoms can be controlled, and the progression and the spreading to other tissues can be prevented if you will do these 3 things that I'm going to talk to you about today. And it doesn't matter what type of autoimmune condition you have, these 3 things are the foundation of your recovery. And you've probably never heard that before, and you probably never will hear it in the conventional medical treatment of this, which is unilaterally just giving steroids. So let's get into this. Number 1, what is the first thing that has to happen to stop the symptoms and the progression of an autoimmune condition? You must heal the gut. And you may say, well, what if my conditions aren't in the gut? What if I have rheumatoid arthritis? Doesn't matter. You got to heal the gut. Because the gut is where, number 1, 70 to 80% of your immune system is. Number 2, the integrity of the gut lining is critical to preventing your immune system from becoming hypersensitive. There is a condition called leaky gut, where you're actually letting things out of your digestive tract into the bloodstream that are not supposed to be there. And when that happens, when a unbroken down food like a protein that's not broken all the way down into its amino acid gets into the bloodstream and the immune system sees it, what's the immune system's job? To attack whatever's not supposed to be there. So what happens is you get an autoimmune attack, and a leaky gut can sometimes lead to a food sensitivity. Or you could allow some type of bacteria or a virus or fungus or parasite to pass through and get into the bloodstream. And that brings me to my second point that must happen, and that is you must remove the trigger. And let me say this, the trigger may be a food sensitivity. It may be that it's some type of chronic infection, and that means that you may not have symptoms from it, but it's causing an immune response. And the only way you're going to determine this is by doing the proper testing and going through the proper history and doing the proper elimination and provocation diet to find out if you have a food sensitivity. Do you have a chronic infection? Do you have a toxin or some type of heavy metal or something else that's triggering your immune system to upregulate? Because until you stop the upregulation of your immune system, you're going to always be susceptible to autoimmunities, allergies, and other types of things. And eventually what's going to happen is your immune system is going to get completely fatigued, and then you're going to end up getting sick and ill more often, more colds, upper respiratory stuff, reoccurrent things, and so because your immune system is exhausted. And that brings me to my third big point. My third point is you must now modulate the immune system. Ultimately, if you have an autoimmunity, you have an immune problem. Your immune system is attacking your body. That's not normal, and that's obviously not good. So how are we going to get it back into order? Well, first of all, you're going to have to heal the gut, remove the triggers, and then balance your immune system back out. You don't want to just suppress your immune system with a steroid where you just shut it down. You want to bring it back into optimal function, not hyperfunction, not low function. And in an autoimmunity, you can have a Th1 dominant autoimmunity or a Th2 dominant autoimmunity. And that means which part of your immune system is hypersensitive. Is it your T cells and your macrophages and your natural killer cells, which is T1? Or is it your B cells, which are your antibodies, your tagging system, which is a Th2 side? And if you don't know which one to support, you're never going to get them balanced. And you also must support the body's natural balancing mechanism, which is called the Treg cells or your Th3 cells. And so once you've done these two things and you get your immune system back into balance, you have an excellent chance now to control your condition and to maintain it that way for the rest of your life. Now, I'm going to be teaching more about these things, what they are, how to do these things in a special workshop in my office. And I want to invite you, first of all, to come to this workshop. And when you come, you'll learn these things and more, how to take care of your condition. And if you need someone to help you determine these things, I will be making a special offer at my workshop to learn how we work with these things. But it's only good for those that attend the workshop. So make sure that it is free, but the seating is limited. So make sure you contact our office and make the appointment, and I'll see you at the workshop. God bless and have a great day.